All right. Good evening, everybody, and welcome to another episode of the G&T podcast. Tonight, we have a very special guest. This is Dr. Doelling. She is a pediatrician who practices in Atlanta, Georgia. And as we all know, childhood obesity and adolescent obesity has been one of the biggest issues nowadays, especially in the Western world. And it has become so prevalent due to multiple issues that we will talk about today. So, Dr. Doelling, thank you for coming, and we're excited to have you.
Thank you. I'm so glad to be here.
Thank you. We're glad to have you. So can you, first of all, tell us more about your practice and what it consists of as a pediatrician?
So I've actually been practicing medicine for about 21 years. I have had a variety of roles. I started as a hospitalist, actually on the cardiac unit at a local children's hospital. And then I became a general pediatric hospitalist for a number of years. Another pediatric hospital. We have one very large system in Atlanta, and that's it. We don't have any competing children's hospitals, so unique situation. But anyway, from that, I did move to outpatient medicine, which I truly love. And then a year and a half ago, I actually opened a concierge practice. So I have a concierge pediatric practice, no insurance, and it's a small number where I can dedicate a lot of time and energy to each of my families.
Perfect. That is very interesting for sure. And, you know, pediatrics is a very unique specialty in many ways, of course. You know, they always teach us that when we start in medical school that children are not small adults, and by all means they are not, of course. And in that sense, you always have to practice, at least if you're practicing in a scope of a hospital, you need to have a dedicated pediatric hospital. So you can't really just be anywhere unless you eventually, of course, work into practice. Right. So childhood obesity or adolescent obesity has become so prevalent nowadays that studies have shown that at least 1/3 of adolescents and children will suffer from weight issues during their childhood. Can you tell us more about the effect of obesity onto the child's health, how this affects them in the future, how this will basically give them what we call in medical terms the prognosis or the outcomes of what they might suffer from in the future as they grow, depending on how they grow as children?
Well, as you stated, it's an enormous problem, and no pun intended with that. But it really is very problematic. And we both live in the Southeast, where we know that obesity is the bigger problem in the United States. The interesting thing, just as an aside, is this is actually a worldwide problem. Now, the United States either tops or comes close to topping the list, depending on which list you're looking at. And the numbers are horrible. It really is horrible. So it's problematic on multiple levels. It's problematic on almost every level because you think, number one, health, which is what we're focused in medicine, right? We're looking at hypertension, diabetes, all of these are on the rise. Even in children, we're starting to look at cardiovascular disease, where we're seeing fatty deposits on the blood vessels of young kids. And the cardiologists have gotten much more involved in this type of problem, hypercholesterolemia, which starting to put kids on statins. I mean, it's just unbelievable. So health problems huge. But I also see, because as a pediatrician, we look at the whole child, and I have the privilege of being able to spend time with these kids socially. Now, who gets teased the most? The fat kid. It's heartbreaking. It really is. But anyway, so socially, it's a problem as well. Self-esteem, and now especially with social media and how really mean people can be because they can hide behind the screen. So that component, we're seeing more anxiety, more depression. There is a component of overweightedness or obesity that really ties into that as well, because we also are looking for perfection, which is ridiculous on any scale, but looking more for it now than we probably ever have in the past. Now, health consequences, we talked about that. Cardiovascular, hypertension. There are also, we have joint issues. I mean, carrying that weight in a body for that many years is very problematic. And then it gets to the adult population where you see it's much more problematic, but it still is so in the children as well. And then we have the ultimate metabolic syndrome, which we know affects a good percentage. I had it on a page, and I'm sorry I can't find it now, but that's a big problem too, the metabolic syndrome, where hypertension, diabetes, those type of health problems are involved. Very difficult to treat.
Right. So it's something that first of all, we touched upon beforehand, and you told me, it's not a problem of the Western world now, not anymore. And that is very true. And that is due to multiple factors, one of which is possibly globalization and adopting the Western diet worldwide. As a matter of fact, the Middle East is definitely, some countries in the Middle East are definitely catching up, and in some studies, what you stated, it looks like they're actually ahead of the United States with obesity. The other thing that we started talking about beforehand, seeing fatty deposits in the blood vessels of children. So to our public that is watching, what that means is that the fat which runs into your blood is starting to get calcified and drop slowly on the walls of the blood vessels, and that eventually what leads to those blood vessels becoming calcified and hardened. And that would lead to heart disease, that would lead to high blood pressure, that would lead to all of those issues in the future. And heart attacks, strokes. And all of these are really issues that we were not seeing beforehand in this patient population. We weren't even seeing them in young adults. Nowadays, in my practice, as somebody who doesn't do pediatrics and adults only, also I see them in patients that are 25 years old, 30 years old because of obesity, and that is a shocker already, let alone to see it in a 15-year-old, a 14-year-old. So a lot of the studies also have shown that once you are developing and you gain a certain number of fat cells, even if you lose weight as an adult, the number of fat cells does not decrease, but that only shrinks. What this would mean is that the number of fat cells that you develop as a child is what number of fat cells that you're going to have in the future, which is probably why it's so hard to lose weight as an adult. And if you do lose it, it's very hard to gain it back just with diet alone. So what is your take on that?
Completely agree. Very difficult once you develop that. But there's so many facets to being overweight and obesity. And you're right, it starts very young. And then the difficulty, the challenge of being able to go to a normal weight as an older person is so, so difficult. We hear stories of that happening, but they are really and truly rare. They're very rare because it is that hard. And as humans, we don't really want to have to engage in hard every single day, particularly as it relates around food. I mean, food is part of living. And then what we're exposed to, and then the emotions around food, which is another whole piece to this, is our relationship with food, which is also very unhealthy. It's very, very difficult. I don't know if you know that he actually recently left our hospital, but we had a pediatric surgeon who actually started doing bariatric surgery on kids.
Right. Oh, absolutely. Yes, and there's definitely a myriad of studies nowadays that show that performing bariatric surgery on adolescents and those who qualify, of course, is safe, and it does help prevent developing those metabolic complications, the high blood pressure, the diabetes, the fatty deposits in the blood vessels, as you previously stated early on, and can help with the outcomes. And something else that you actually touched upon beforehand, and just want to emphasize, you said you touched about the psychological implications and the anxiety of being bullied and all of that. It shows you again, one more time, and something that we've discussed in previous episodes, how complex of a disease is obesity, which is like any other disease in terms of complexity. It is never one thing, calories in versus calories out, but rather is the complexity of a whole disease that has also mental issues playing a role, genetic issues as well, among other environmental factors, of course, as well. So one thing that bothers me particularly, and when we talk about children and adolescents, that whenever you go to, say, a restaurant and you look at the kids' menu, it always tends to be junk food. And people seem to think it's okay because they are kids. They can eat whatever they want and it's okay. So if you look at a kids' menu in a typical restaurant, it's always some sort of pizza, fries, chicken fingers, food that is highly processed, high in calories, mac and cheese. So, what in your opinion can we do about that to educate possibly the parents as well to sway them away from all of this in a world that is centered about this, basically just consumerism of this highly processed food and unhealthy food?
I think that's the crux of the problem is really our food portions, our food types, and the availability of inexpensive food as well. So we have developed cultural habits, and our cultural habits are to grab the food, go out to eat. I don't know what your childhood was like, but I am from a military family, and I have 6 brothers and sisters, and we didn't go out to eat. It was too expensive. You know, a treat for us was to go to McDonald's once every 5 years, I think. And then even the burgers were little tiny things. So I think I do think that's an enormous issue. And it goes, part of it goes along with our culture becoming very wealthy. And so parents take their kids to restaurants. They spend a lot of money, which is shocking to me. But then also you've got the other end of the spectrum where parents are taking their kids to McDonald's because they're dashing home from work, grabbing the kids. It tastes good. It makes them feel full. You can get it done pretty quickly and not spend too much money. So it's cultural. For kids, it comes from the parents. I'm very, very open. I'm very honest about talking to parents. And when I'm talking to the parents, I'm talking to the children too about living a lifestyle, and that I expect the parents to set the example. So I say your children, whether they say it or not, they are going to mimic what you are doing right now. So if you establish certain habits now, your children are more likely to take that into adulthood. And then I talk about getting rid of the snacky stuff, the processed stuff, start planning menus one day a week. If you don't have a lot of time, purchase your food that one day a week and start thinking through what you're going to eat. And then trying really hard to be reasonably healthy. So for young children, that is coupled with activity. And again, I don't know about you, but we were never inside the house. If we weren't in school, we were running around playing. Now kids are inside, they're on, their social media, their TV, whatever it is they're on, and they're just not moving enough, which, I even talk about that in bone health. Bone health requires vitamin D, which is not derived from a tablet. It's derived from the sun. It's the best way to actually process your vitamin D where the body can recognize it. And then it's moving. It's a weight bearing. And for a kid, it's just playing. They get much better bone health through that. So that's just an aside. So, but I do talk about all those things. I do talk to families, and I consider it a long-term issue. So I talk multiple times, and because I have the time to talk to families, I'm really excited because I really have seen some remarkable changes in kids that they are taking upon themselves. It's actually really super cool. Get up and move, and then I tell them how proud I am of them. They are proud of themselves because they know, it's different the way the other kids look at them, the way they look at themselves. But it starts with the parents and making choices and healthy choices so the kids can model that.
Right. And definitely what you mentioned beforehand, I grew up in Jerusalem. So definitely, like you said, eating out was was also something that you did once in a blue moon, and that was a treat, like you said beforehand. Yes, we did eat, go out to eat fast food or unhealthy foods once in a while, or for ice cream once in a while, but it definitely was not the norm. The norm every night for dinner was to eat exactly homemade or home cooked foods that are mostly whole foods in many ways, and that was healthier. And in a sense, also what you stated beforehand, being outside, being active. Of course, I recognize that the world has changed, and that is something that is inevitable. And a lot of the kids nowadays are going to spend most of their days in front of a screen, even if just for school. Especially with the COVID-19 pandemic now, and that is part of it. And we understand that, but it is still important to also make sure that they still stay active. I always say one of the best things that I see in bariatric surgery, in adults even, is how it trickles down into whole family and the kids as well. What you touched upon beforehand was very important. A lot of the studies that they've done over childhood obesity, the way that they figured out what the kids were eating was by looking at the parents and what they were eating, because most likely the kids were eating the same as well. And kids will also basically imitate what we do, even in a behavioral pattern, just not just related to food. If you take a look at your child and you see that if he answers the phone, he's more likely to mimic your tone when he does, or she is more likely to do that as well when she does pick up the phone, because this is how humans learn as kids, and they just basically imitate the adult as they grow up. And so, if the habit is to see us come back from work and immediately sit down on the TV and be sedentary for the rest of the day, this is how it's going to be. If we bond with them as well over a bike ride after work, or even just a walk, it doesn't have to be anything that is fairly intense or complex, but just going for a walk and being active, this is what they will learn, and this is what they will bond with us over as well. And that is definitely very important.
Yeah, I just had this talk with a family too, and I'm a big believer in walking as well. Get out and do it with the family. And then I love to talk about, so sometimes I like to relate to my life and just normalize the situation. But as my kids were growing, I'm a big exerciser. I like it. And so I did that all these years. I really think my kids thought I was crazy, but guess what? They're young adults now. And guess what they do?
They exercise.
They watch their weight. They're aware of it, which is the most important thing. So even if the kids, which will naturally move away from you and want to think that what you do is ridiculous, they will come back to it because they've been conditioned to that. So this is where, just as you're saying, we need to capture them young. We need to capture the families young. And there need to, I hate to say this, and I don't love a ton of government intervention, but I do think the government needs to stand up and say, this is a problem. Call it as big of a problem as COVID, probably even worse, for many, many reasons. And I don't want to get in trouble for saying that, because I don't want to say one thing's worse or not, but it is a huge problem, takes a huge economic toll, social toll, so much across our entire country.
Absolutely. So,
and to stop normalizing obesity and saying it's okay, because it's not healthy and it's not okay.
Right. And it's not about the looks, but it's rather about the health. And that is something that we need to take ownership on. And we have means nowadays of stopping it. Of course, we always try with the conservative means of diet and lifestyle change. And when those don't work and people who qualify, this is where we come in bariatric surgery. And this has been shown to be sustainable on the long term as well, to help with the weight loss. So a big part of obesity in childhood, or obesity in general, I should say, is genetics. What has been your experience with that? There are multiple known genetic defects that can cause obesity, and there are also not so well-known genetic factors that play a role.
So I know that, and I'm sorry, I don't know the exact gene, but I do know there is now the ability to determine if a particular child has this gene. And we have seen that. It's not common. It is not common, but it is there, and it does contribute to obesity. That does make it very, very difficult if you're a wired for that. And that to me is a separate situation because that's such a small number. And that's probably where you all would come into play much more quickly than not. What I see mostly is lifestyle. It's over and over and over again. And then you definitely see the parents tend to be the same type size as their young children. But to see a 4-year-old who, weighs as much as they do, it's distressing, right? So anyway, so just to your question, yes, genetic factors, but that's a small portion.
Mm-hmm. And one of the genes that we know mutation that can cause that is Mc4 receptor mutation, and that what you stated, Dr. Doelling, is rare. This is not the norm. Most people who have obesity don't have that. But there are other genetic factors, of course, that play a role, some of which we do know about, other genes, and others we don't know about. And when I say genetic factors, this could be predisposing me to have a slower metabolism and as a result being more predisposed to obesity. But also some other genetic factors mean that when I watch a TV ad of unhealthy foods, which of course, nowadays in our world, there's not a shortage of, that does not necessarily affect me as somebody else who has more predisposition. That also might mean that they have more predisposition to be affected by that ad more than I do. And that's also something that plays a role too. So it's not just about metabolism and the weight as well.
The one other thing I do want to add is that I don't believe everybody needs to be skinny. I think you're kind of lucky if you are, relatively thin and that's your genetics, or you work at it even. And I'm very quick to tell people I don't look at numbers probably as much as some doctors do. And I don't shame children. So the thing that I have on my side is linear growth. Right. And so I can say to them, I don't want you to diet, but I don't want you to gain weight, or I want you to gain a limited amount of weight because, we can predict you have about this many inches to go. And, how great would that be? And we do see that. And they can understand that. So, going back to I hear what you're saying, but it's still some people are going to be bigger and that's okay. But if it's from the extra eating and the lack of exercise, then that's where it's really problematic.
Correct. And sorry, go ahead. Yeah, Dr. T.
No, but I think the majority of our kids, nice to see you, Dr. Doelling. Apologize. I just got here from surgery.
Yeah, that's okay.
So it's been a crazy day and week. So, we piggyback on what you said. I think I'm pretty certain the majority of the kids or the young adults, should I say, right, adolescent that we see overweight or with obesity, it's all pretty much 90% of them is pretty much from behavior issues, right?
It's probably more than
I don't
90.
think it's just, yeah, right. So I think that what you're talking about, the percentage is so small that, I don't think we ever see those patients, right? And also there is that thing that people believe that I'm overweight, I'm obese, but I'm healthy. There's no such a thing as a unicorn.
There's no such thing. But,
right?
But our culture is normalizing that. Our culture is saying, look at me, I'm fat and I'm beautiful. And while you may be beautiful, you're very unhealthy also. So, we're moving into this normalizing of fat and obese, and we're doing it in the fashion industry even as well. And this is, I was telling your partner just, we've got to stand up as a culture and say, no, this is not okay. And your looks are immaterial. Your health is everything.
Oh, 100%. But that's, if a society is getting more and more obese, or larger, should I say, right, then the economics of things have to change, right? So what you sell, right, you have to adapt. What looks good now versus what looked good 10 years ago, 20 years ago. So all these has to adapt, right? I mean, we have patients that come to us. Like yesterday, I saw a 14-year-old girl with a BMI of 62. That is just not normal, right? I mean, that is just unheard of. But that's the things that we see, right? So people don't understand that this is a true reality, right? I mean, you don't. This is not just a case here, case there, because we just became recertified as a pediatric obesity center, right, to treat patients with surgical intervention. And it's real. I mean, the numbers are there. We can see the volumes that we did, you know.
Mm-hmm. Mm-hmm. And then we talk about, too, we do know that socioeconomic factors play a role. We do know with higher level of education, you tend to have less obesity. And then you see it in ethnic groups that definitely have more obesity than others, which probably is also tied into the socioeconomics as well.
Oh, for sure, for sure. I mean, that's why I say my definition of obesity is culture, where you're from, genetics, social, economics, pretty much, right? You put all of that and mix it in a pot, that becomes, in my mind, a definition of obesity in America.
So, yes, I do agree with you because it is multifactorial for sure.
We talked about also, about that beforehand, and about the medical conditions that you see with adolescents, that we've already seen them earlier and earlier in obese children. And you stated that also you're in a facility that do perform bariatric procedures on adolescents just like ours. So have you been able to see those improvements that happen with the bariatric procedures in those young adults after the bariatric procedure was done?
So for me, I actually don't work with this department and I'm outside of hospital medicine now, but I do know that they have had success with it. They do counseling around it and that kind of thing. And I don't have their numbers though. But I do know it works. It definitely works for the right child. And the surgeon who actually brought it to Atlanta was so devoted. I mean, just very devoted to getting kids out of being just morbidly obese and trying to give them, a chance at living. So I do know it is safe in the right patient. I do think you need a team in order to take care of these kids. And then, there has to be support, a little bit of emotional support as well.
100%. And one of the things I think we also encounter is the kids, they have to want it, right? So, because we see parents bringing their kids to have the surgery, want to have the surgery, but the kids don't want it. Right. So of course we don't do it, but we see that pretty often, to be honest with you.
Interesting. Are they afraid?
Yeah.
Is it because the kids are afraid? Because I'll tell you, kids do not want to be fat. They do not want that. They don't like that.
Yeah, but they don't want to be forced to do something either.
Yeah. Yes.
Yeah. So if the kid is not ready yet, right, then it's very difficult for you to take the kid and say, let's go ahead and do this operation. It's going to help you. I mean, sometimes they don't even understand what's happening, what's going to happen, So it's a little bit more difficult when the kid doesn't want, right? Because now you have to tell the parents.
True. I think, I mean, I understand what you're saying. For even any age, you have to want to do this, right? And then I was talking to your partner earlier just about how what I love doing is building relationships and then, talking over time. The first episode is never successful, or it's rare for that to be successful. It's the one where, I tell them I'm not focusing on the number, but, this is why I care about them and why I care about their future. I talk a lot about the family dynamics, and I talk to the mother in particular because they tend to be the leaders of the food. you do see over time. So I think it's in developing the relationships where you could capture more of these children. I don't know if you partner with pediatricians, that would probably be a kind of a cool thing to do, or family practice doctors who, take care of the younger population.
Yeah, so we partner up with a lot of the pediatric groups here, but also the largest GI peds group in Central Florida. So, which is they see a lot of patients, right? And what we did with them, they do all the workup in terms of the psychological perspective. They do all of the nutrition perspective, right? And then we come in for the surgical perspective, or even endoscopic approaches too for those patients. And it has been a very interesting partnership with them. I think we that their GI person that leads it, that part, it's been great, in terms of collaborating together,
No, I think that's really smart. I think it's smart to have the medical team on board, or, along with you all.
What tips do you have for the parents if they notice that their kids are swaying more towards unhealthy habits, that be it diet-wise, that be it being more sedentary that they should? How could they potentially sway back their children back on track into their into that healthy pathway? And as Dr. Teixeira has mentioned beforehand, sometimes, of course, kids don't want to be forced into something they don't want to do. And so what tricks have you noticed that work best?
So I do talk to parents. I'm a big workout person, and I've been this way my whole life. So I do. And I know that not everybody likes it, but I also know that what goes in is more impactful than what you burn off. So, and while I'm a big believer in exercising, huge believer in exercising, my 92-year-old dad still drives to the gym 3 days a week. Just saying. Yes, exactly. But anyway, I talk to them about the food in the house. If you don't want your child eating cookies, you do not put those cookies in the house. And I'm really, really big on that with choices. So the choices that are in the house have to be the ones that you want them to eat. And that's it. And the junk shouldn't be in there. I think that treats every once in a while are important because you don't want to deny all the time, but you've got to get the bad food out of the house. It's all about that.
I agree. I mean,
It's kind of simple too. I mean, someone can understand that, right?
I mean, it's the same thing for adults, right? I mean, like
Yes.
We know our own.
Well, I'm always talking to the parents also, because usually there's a very strong correlation.
Right. And absolutely, what you put in is way more important than you burn out. A lot of people exercise a lot all the time, but then they come to us and say, well, I'm not losing much weight, but okay, what are you eating? How much are you eating? And that really becomes twofold with children, because of what we mentioned beforehand. Their bodies are forming, so what you put in them today is what their body's going to be made of in many ways, in a simple way to think about it. And then also those fat cells, once they form as adolescents, the number of fat cells is never going to go away when they grow up. They only shrink, right? Which we talked about beforehand.
I love this part of medicine, and because I do think it's so important. I'm a big believer in creating a healthy person as opposed to treating a disease. Although, that's a big part of what we do. And I love doing that also. But if your foundation is healthy, you just have such a better chance at combating COVID, anything else that comes out there.
Yeah. So that's funny. My dad is an endocrinologist, right? And he always, him and my mom too, give credit to both of them. They always said, the habits that you start in your kids at a younger age are the habits they're going to hopefully use later on in life, right? So we never had soft drinks in our house. So I don't drink soft drinks. I mean, I'm going to say I've never had soft drink now, right? But last time I had a soft drink was probably 8 years ago because I just really stopped. We are now really into desserts because that's how I was brought up. I was never brought up with you have to eat and they have the dessert. The dessert to me was just a foreign concept because we never had that, right? We never had cookies, cakes, and things like that in my house. My son, he's 11 years old. He has never had any soft drinks.
Good. Very
right?
good.
Yeah, but granted, he cannot see a cheeseburger, boy.
Well, he grew
Well,
up in
I'm with
America,
him on
right?
that one because I would love a cheeseburger.
I know, right? But you adapt, right? You try to do a different type of bread, different type of meat, and so forth, and you play around. So we try to make it healthier as much as we can. Thank you very much to
Thank
participate
you.
in
Thank you
this.
for the work you're doing.
Um,
It's very meaningful.
I think all of us are doing this, right? I mean, it's a team effort. Listen, awesome. Thank you so much.
Thank you so much. It's very nice to meet you.